So hi, everybody. Welcome to the end of the second day. I'm Kareem, the AVP for Commercialization and Entrepreneurship at the University of Waterloo, and I have the distinct pleasure of inviting conference co-chairs, President Vivek Goel and President Rohinton Medhora, to close the conference. If you will, please, Presidents Goel and Medhora, take the screen.
Great. I'll start off, Rohinton.
Okay, go for it.
Thanks. So the past 2 days have highlighted the exceptional research advocacy and industry action being done in Canada and around the world in the areas of health data, public engagement, policy governance, and interoperability. The importance of collaborations between governments, industry, and academia is becoming even more profound as we continue to explore solutions to improving public health. We heard very clearly the importance of taking a person-centered approach. If we don't focus on patients and their needs, we will never have the health system we aspire to or the data we're looking for. We've also just heard how rapidly technologies are evolving and creating new and perhaps terrifying issues for us to keep up with. We are starting to take the right steps toward improving data literacy to turn the ocean of data to usable knowledge. But data literacy is necessary, as we heard, at all levels of society. I acknowledge the important role that we can play as educational institutions in our programs with preparing our students, future teachers, for being ready to work in the world that we are developing. And we are also developing initiatives with partners to reskill and upskill those already in the workforce. And as we've heard, researchers are collaborating with colleagues across disciplines and around the world to help address the issues. As we heard many times, the challenges we face in Canada are not unique, and there's so much to learn from other jurisdictions and the global community. By learning from these examples, we can avoid some of the pitfalls of this transition while recognizing that each jurisdiction must foremost meet its populations and the opportunities where they exist, and not be tempted to apply a one-size-fits-all approach. Throughout this event, we have discussed critical gaps in Canada's governance regime related to health and data. The Minister of Health in his greetings showed that he understands the work that needs to be done. I also appreciate his recognition of the work of our expert advisory group. We've explored the systemic barriers obstructing the widespread use of health data. As we heard repeatedly, we need to address issues of governance and policy if we're going to have success with our implementation of systems. I'm so pleased we were able to partner with CIGI, a leader in thinking about how to improve governance, in planning this workshop. We know there's still much work to be done. It doesn't end with this conference. A summary document highlighting key insights and recommendations will be prepared, and I hope this document can assist those working towards making bold systemic change. While we couldn't be in person, we're grateful for the work of our organizers, presenters, panelists, and delegates for committing to make a difference and participating in this event. Thank you for your efforts, and over to you, Rohinton.
Vivek, thank you. I would sort of echo absolutely everything you said. And let me just say it differently in by making 2 or 3 points. I guess the first thing that struck me was how much the questions around health data are about health and data, and how much they go well beyond it. The quality of the health data system we have will be and is a reflection of our larger society. How do we value people? How do we value human rights? How advanced are we with technologies? What governance regimes do we have around them? What legal frameworks and how enforceable and enforced are they? So health data is playing out in a larger discussion in society around how people interact with each other, with their governments, with their communities, and in fact with technology. And I thought many of the sessions touched upon that in different ways. My second observation is how, and this was a gleam in our eye when we first talked about this when CIGI and the university got together, is how we require different groups and quite disparate groups actually to come together and think this one through. We think Canada is complex because it has several levels of government, of which there are at least two, national and provincial, which we know come together, often imperfectly, in the health sphere. But then when it comes to health data, think about the various kinds of sciences, humanities, and social sciences that we need to work together to design what would be a world-class health data system. And so I think that brings me to my third point, that I think we fleshed out a very rich research and policy program for years to come. As I said earlier this afternoon, there's several PhD theses in almost every slide that we showed. Multiply that by the number of issues we covered, and I think this is a rich area for collaboration. So I hope this is the start and not the end of a community coming together and what we call a community of research and practice. Like you, I will thank our colleagues in the events teams, in communications, and in content, the various participants, all of you for joining, our panelists, and of course, you and your office, Vivek, for making this all happen. So I wish you all well, and thank you again.